Good evening, ladies and gentlemen. This is Gerardo Poli.
And this, sorry. Okay.
I'm Gerardo Poli.
I'm Hubert Hemstra, and this is the Vet Vault.
We're back with Professor Alice Defarges from the Ontario Veterinary College at the University of Guelph. In this episode, we're talking about imaging of the gastrointestinal tract when you suspect a gastrointestinal bleed, and specifically the use of capsule endoscopy. Shoving a pill, which contains a camera, down a patient's throat is not an entirely new technology, but for a long time, it has been very limited in its usefulness to veterinarians. However, in recent years, there has been major advances in tech in this field that has significantly increased its utility. Alice talks us through when to use it, how to use it, what it is not good for, and what it is great for.
If you haven't listened to the previous episode with Alice about how to interpret your initial diagnostics to get you to the point of imaging the gut for bleeding, go and have a listen. It's great revision and it will help you to clarify some potentially confusing topics. This episode is brought to you by ALICAM. When we're talking about capsule endoscopy, we're really talking about ALICAM because ALICAM is the world's first veterinary capsule endoscopy unit. We'll give you more details about a few of the practicalities and where you can get a hold of it a bit later in the episode. Go and check them out at fourlimb.com.au. That's FOURLIMB, fourlimb like in four legs.com.au, and enter the discount code VV for VetVault to get 10% off on your first order of ALICAM. But for now, back to Alice and our journey into the canine gastrointestinal tract, searching for trouble.
We see anemic dogs all the time, and the ones where, especially the ones we talked about, which are gastric ulcerations, and because sometimes you see hematemesis, or sometimes they're just like they got melena around the back end. And I've put scopes down these dogs, looking down the esophagus. Esophagus is not that hard to kind of squeeze, go up and down a couple of times and make sure you see everything. And then you go on the stomach and you inflate it like a big balloon. You turn it around itself and, play around. But then getting it into the duodenum is like next level pain in the ass. Like when you get it in there, it's like an achievement unlocked for an emergency vet. You're like, oh my God, I got it in the duodenum. And then you can go about 1 inch and then you can't push it any further. I don't know. What's your process there? Do you still kind of go through the endoscope kind of pathway? Like what's new there?
Yeah, so the endoscopy is the conventional endoscopy is a good mean to assess the gut. So you can go to the esophagus, you can go to the stomach. After going to the duodenum, it's a little bit more tricky. You need to be trained for that, so you need to learn how to do it, and it takes like hours. It's a steep learning curve, but it's a lot of time to be trained. Mm-hmm. You can go to the colon as well through the rectum. But then there is a big part of intestine that you cannot reach because of the diameter of your scope and because of the length of the small intestine. So you need to remember that the dog intestine length is about like 5 times the dog's length. So There is no scope that exists that can go through the intestine of a dog or a cat, same thing. So you're missing a big segment of intestine. One of the major drawbacks, I think, more and more actually, is that people don't want to put their dog under general anesthesia to just like scope the dog or the cat. So for people, you don't have to. You're under sedation and they scope you.
Can I go back a step with you, Alice? So I feel like Gerardo's jumped ahead a bit of the game a little bit to endoscopy. Endoscopy is it's more and more common, but I think lots of vets are quite intimidated by it. I certainly am. I can drive the thing and I enjoy it, and it's fun to go and fish out foreign bodies. But when it comes to more subtle things, my big concern is that I'm going to miss something. I'm going to GA a dog, go through this whole procedure, and then miss something that's a little bit less obvious. But before we get to endoscopy, if I suspect GI bleeding, are there steps in between? I'm thinking we're going to send it for an ultrasound or something like that. How useful are the other imaging modalities in investigating GI bleeding?
So my experience is the same as yours. Is like I don't have the skills to diagnose like ulcerated like stomach based on a like based on ultrasound. And those cases sometimes come at night, and you don't have access to people who are trained to do like very skilled, like an ultrasound exam. So what I do usually is that if the dog looks like he has perforated, then the radiograph would be pretty helpful, because you can see like free gas in the abdomen sometimes, or AFAST would be also helpful. Sometimes you can see like fluid, and if you don't see fluid in the first hours, then if you put your dog on fluids, then I always like re-AFAST them, and then sometimes you can see fluid accumulating. So that would be my approach. But then if your case is pretty stable, then we're not suspecting any perforated like ulcer. If it's a chronic anemia on a dog that is wagging his tail and is doing well, but otherwise is anemic, then I don't use like radiograph, because they're usually like not very helpful. So I use like either I ask for an ultrasonographer to come and do the specialized like exam for me, but it's more to rule out other causes, because even with a very trained like ultrasonographer, they cannot really rule out a GI ulcer based on their exam. They can sometimes, when they see something, when they see like gas trapped in the mucosa, then they can tell you that they're suspecting GI ulcer. So I go to my next step, and recently I've been using like capsule endoscopy, and it was not available before for dogs, or I should say like there was like capsule endoscopy that we could borrow from the human medicine, but they were not very easy to use in dogs.
Wow.
And recently we had like new capsule endoscopy, so I use that most of the time.
You see, that's awesome. I remember that at university, it was mentioned. They said, yes, in human medicine, they use capsule, but they kind of poo-pooed it. Our lecturers were like, yeah, it's not that useful. You're only looking at one side of the gut, so it's very easy to miss things. So what's changed in capsule endoscopy now to make it more useful for us?
So the first capsule endoscopy that were launched probably more than 20 years ago in people, they were just like 120-degree angle. So there was one camera at the tip of the capsule. And so you had like just like an angle that would look like an endoscopic view, like the conventional endoscopic view.
Mm-hmm.
But with the conventional endoscopy, you can guide the camera.
Of course.
With the old capsule endoscopy, you cannot guide it and you cannot insufflate. So you're completely relying on the random movement of the capsule. So you cannot interrogate all the gut. So you can miss a lot of things. The other trouble that we had with the old capsule that was on the market is that you had to have like a big recorder attached to the dog. You had to fix it on a belt. So you needed to put the recorder on a basis, and the basis with the software was very expensive. So I looked it up and I gave up because I didn't have the money as a professor to buy it for my patients. But it looked very interesting. But then suddenly a new capsule came out. So I got super excited, and I've been using it for probably the last 3 years.
Okay, so what's different about this guy?
So the new capsule is very different. So there are 4 cameras around the capsule. So it gives you a 360-degree angle. So you have a panoramic view of the gut.
Do you wear a VR headset? Do you wear a virtual reality headset when they're reviewing the footage, and it's kind of like you turn their head?
We should approach the company and ask that.
I can imagine
that would be even more exciting. So the capsule is really, really cool. So they don't have to wear any vest, any recorder on them. You actually peel the dog and then it goes back home. So it's really cool. It's really, really easy. It's like peeling a dog with a vitamin peel.
And then you're on poop collection duty for a while.
Yeah, so the only drawback is that you need to get back the capsule, because the capsule has a flash memory in it. So it keeps all the pictures. So you don't have a big recorder to buy. You just have to buy the capsule, and there is no training associated with that, no big equipment to buy. But then you need to ask the people to collect the capsule in the poop, but usually they poop it like within 24 hours to 2 or 3 days at the most. I was like really, because my dog pooped it like within a day, and I developed like a lot of skills to search the poop of my dog. But like honestly, I was skeptical about the reaction of the client, and all clients were so excited by the capsule technology that no one felt uncomfortable to search the poop. They even like, yeah, no, it was amazing. So we even like offered them to keep the dog to search the poop for them for 1 or 2 days to board the dog, but no one wanted to do that. And the capsule actually, which is very cool, and my kids loved it, that when we gave one to my dog, so it's blinking when the battery life is still like working.
Yeah.
So if your dog poops it before it turns off, so before like 15 hours, then in the poop it will blink. So you can find it very easily. So it's very convenient.
I can see the attraction to clients. It's a little bit like an Easter egg hunt, like a disgusting Easter egg. I think my kids would actually fight each other to go through the dog's poo to try and see who's the first to get to the camera. We're going to take a short break to give you some of the practical details about ALICAM and our sponsor, Forlim Surgical Supplies, who is where you'd buy ALICAM from here in Australia and New Zealand. Forlim has been providing surgical supplies to Australia and New Zealand for the last 7 years from right here in good old Perth. And they pride themselves in maintaining great relationships with their customers, that's you, the vets and nurses, as well as with all of their suppliers from around the world. Alice will cover most of these topics in the episode, but I thought we'd do a very quick little user guide summary for you. So you have a case that you think could benefit from having its entire gut filmed. So what do? And I'm going to interrupt myself here to clarify that this is not a specialist thing. It's very much designed to provide fantastic imaging capabilities to your average GP vet. So you contact your local ALICAM provider to order your ALICAM, and in Oz and New Zealand, that'll be Forlim at forlim.com.au. That's FOUR, like the number 4. Here in Australia, it'll arrive in 24 to 48 hours max, depending on where you are. Alternatively, you could keep a few of them on the shelf because the battery only activates once you take it out of the box, so you can actually hang on to them until you need them. Then it's simply a matter of pilling your fasted patient like you would with any other pill. Then you send the dog home if the owners are happy with that, and if they're happy to be on very strict poo control for a day or 2, or you can keep it in hospital until it poops out. Once the capsule comes out the other end, the owner will bring the capsule back to you, hopefully pre-cleaned, and then you send it back to the local supplier, who will download the thousands of images onto a special reader and send it to one of their medicine specialists in the US, who will review the entire series and write you a full report with a list of DDs, suggestions, and everything you need to know. So you get a specialist consultation plus a link to the images that you can look at yourself and share with the owners, which they love. No special training, no equipment purchases, no anesthetics or sedation, and a ton of very useful information. Super simple. Now I want to tell you a quick side story just because I love it so much. Sebastian, or Seb, who is the founder of Forlim, and I actually go back a while. He was the first vet to be employed at my after-hours vet business. You could say that we built the business on the back of my and Seb's lack of sleep. After a few years, Seb's then fledgling surgical supply company took off, so he left me to tend to the sick animals while he focused on taking care of vets and their equipment needs. A few years later, I came across ALICAM and I loved it so much that I seriously considered becoming the distributor for it here in Australia. I asked Seb for some advice on selling and distributing products, and I eventually decided to stick to clinical practice and not pursue the selling part of it. But Seb saw the potential for ALICAM that I saw, and he decided to run with it. And now here he is supporting me again with the podcast. Now I just love this so much. It gives me such a thrill to see how this all went full circle, from us working together and building a good working relationship and just treating each other with respect to where we are today. We talk a lot with our guests about connection and the importance of relationships here on The Vault. At least I do talk about it a lot. And this story illustrates that perfectly for me. How the people who cross your path might end up playing an important role in your life later down the line in ways that you can't predict right now. So it's worth investing in all of your relationships. And I don't say this just from a selfish perspective of try to be nice to people because you might be able to benefit from them later on. It's rather an attitude of give the best of yourself to everybody you meet whenever you can, because the resulting relationships that will come out of that attitude will be the things that eventually matter most. But that's enough babbling from me. Let's get back to Alice. I just want to go a step back. So you said this so it's got 4 cameras. So does that eliminate that 120-degree limitation of just seeing a part of the gut? Well, like, what is the picture that you actually get out of this?
So the big advantage is to get like a panoramic view, but you're not seeing the lumen. You're not seeing the same picture as a conventional endoscopy. So, for example, for stricture, you would not see a stricture. Saying that if your dog is regurgitating or is vomiting profusely, you would not give the ALICAM because you're suspecting a partial obstruction. So we don't usually give this type of capsule to a dog who has suspicion of obstruction of the GI.
Okay. But in terms of wall pathology, you're getting a 360-degree view of the entire gut wall.
Yeah, sorry, I didn't understand the question. So the panoramic view is amazing because you miss less lesion because you're seeing, like, for example, in the intestine, you're seeing the entire intestine because you're seeing like the 360-degree like picture of the intestine. There are 4 cameras taking like 16 pictures per second.
Wow.
So you're not missing lesion. Yeah, it's a lot. So you're not missing a lot of things actually with this capsule. And it magnifies a lot. So you can see a lot more actually because it's a closer view of the mucosa. So I've been surprised, but at the beginning I was skeptical, like with every new technology as an old dinosaur. And I did capsule and then I scoped the dog after with conventional endoscopy. And I was surprised that I was seeing more stuff with the capsule than with my scope.
Wow.
And it's just because it magnifies more. And I think also it's more physiologic. So for example, for bleeding, you can miss bleeding with the conventional endoscopy because first it can be intermittent. And then you cannot anesthetize like 4 times the dog to scope and make sure that it is the day where he's bleeding. And then although you're insufflating the organ, so you're stopping the bleeding probably in some places because you're putting like tension on the organ.
That's cool. So then, sorry, but how do you access the images? So the camera, you shove the camera down and it goes through. Then how do I see or interpret the footage or the photos?
So to get the picture, it's pretty easy. As a vet, you just have to send the capsule to an Infinity office and they will download the capsule and they will look at the picture, the video. So a trained endoscopist will look at all the study and they will come up with like an interpretation of the study, and they will also provide like a consultation, actually a recommendation about the patient. So what to do, what is the next step, what they think is happening. And so it's like a package. You're getting like pictures and a consultation from a gastroenterologist.
Wow.
That's very nifty.
I just want to see what this looks like. Is there an upgradable version when you get the VR headset that comes with it? I will get over that sooner or later. But okay, so swallow the pill goes down, you get the whole entire GI tract. Do you feel like as if you miss parts of the stomach because it kind of sits in a rugae, or do you find that as like with time it kind of moves around the vast majority of the stomach anyway as part of just contractions and things? Or
so for the intestine, definitively the 360-degree angle and the fact that it travels like throughout the intestine, I would say that for the small intestine is the best exam because you're seeing everything. In the stomach, it depends. So there are some dogs where the capsule like stays there for like 5 hours. So you're hoping that the random movement of the capsule gave you like a broad view of the overall like mucosa. But you could miss some things because you cannot insufflate. So some lesions could get like hidden just behind like a fold. So you can miss some things. Sometimes the transit of the capsule in the stomach is super quick. It's pretty rare, but it can happen. And so you could miss something. But that's, for me, it's not a big deal because you can do if you really think that you missed something in the stomach, you can redo ALICAM. Doesn't take any general anesthesia. So you can try that. There is some different tricks that you can use to decrease a little bit the transit. In people, it's like chewing chewing gum. I don't know if we can do that in dogs, but I saw that. But you can fast the dog longer. It will decrease the transit, for example. So that would be a trick. And then if you really think that there is something in the stomach and the ALICAM didn't pick it, then it gives you an argument for the client to recommend the conventional endoscopy. So that's a good first step. That's another tool in your box. It doesn't replace anything, but it's another tool to rule out some things and convince you that you need to go further.
Yeah, sure. It's like an adjunct to, it's like ultrasound is good with X-ray, or ultrasound's good with an endoscope. It's like it's another way to really kind of completely assess the small intestine, like in a way we've never been able to before, apart from ultrasound, really. Or surgical biopsies or something like that. So, which probably still has a place as well, anyway. So, doesn't it?
So we're not throwing away our endoscopes. Damn it.
I love watching people doing endoscopes, and they try to change the direction of the endoscope by tilting their head.
I do that.
Yeah, and Alex gets seasickness from it, and I think it's like playing a computer game, and reminds me of Empire Strikes Back, where Han Solo's flying the Millennium Falcon through that big worm that's in space. I don't know if you guys remember that scene. I'm sure some people out there will remember that scene.
Oh, I love Star Wars.
Yeah.
I'm so glad my kids are old enough that now I can watch it with them. I have an excuse.
It makes me feel like as if I'm like in a spaceship. It's cool.
I find that a key thing for endoscopy is it helps when you stick your tongue out as well.
Oh, that's hilarious.
Okay, so we're still going to be scoping things. So, some cases will end up being scoped as well. What are the sort of indications where, well, let's say where ALICAM is going to have limitations, where you're going to go, okay, well, let's look at a scope or another modality on top of that.
So for sure, foreign body, of course, foreign body, you cannot remove it with the capsule. When you really need a biopsy, you'll need to have tools and guide the camera. So I think that would be something that would be a limitation of the capsule. And sometimes the capsule, for any reason, does turn off before reaching the intestine. So what I've been using is take a device, and actually almost in all my cases now when I'm scoping, I take the device and I drop an ALICAM in the duodenum. And then it gives me like the entire gut evaluation.
So you scope, you go in with the scope, have a decent look at the stomach, because we talked about the stomach problems, and then through the stomach and go, okay, that's as far as I'm going to get with my scope. Drop it an ALICAM down there to evaluate the rest. Oh, that's awesome.
Oh, you'd scope the colon there at the same time, or you kind of?
Most of the time I scope. So now, like since they prove that a lot of diseases are more easily diagnosed from the ileum than from the duodenum. For example, in cats, I do the lower as well. But in dogs, sometimes I don't, and I usually drop an ALICAM, and then it gives me the entire gut. It gives me like an image of everything. So when I scope now, it's very common that I drop an ALICAM in the duodenum. What the conventional endoscopy does not have is the ability to measure the motility of the intestine and the stomach. And I think that is a big advantage of the capsule. This is why I use it too. It's I think we underdiagnose a lot like dysmotility disorder in dogs and cats, and I think a lot of our supposedly like IBD dogs are probably suffering just from intestinal dysmotility. So I think the capsule also is great because it gives you it has like a clock inside, and so it gives you like a measurement of the transit of the stomach and of the small intestine.
Wow.
Can you use it in cats? You've mentioned cats a few times. Can you fit it down a cat's throat?
Sorry, I was just mentioning cats, but you cannot use it in cats, unfortunately, for now. I hope that soon we'll be able to do it. So you can use it in horses, but the limitation is the size of the gut for now, because the capsule is like 11 millimeter times like 33 millimeters. So it's a big vitamin capsule.
Okay.
So the smallest dog that swallowed the capsule was 4.3 kilogram. I'm a little bit chicken, so I usually my cutoff is like 7 kilogram.
Yep.
Okay.
I totally see the application there, especially having scoped stomachs and esophaguses and proximal duodenums myself. I love the idea of putting like the ALICAM at the end and depositing it into the small intestine, but sounds a little bit like kind of like specialty referral practice. It's like what's the application there for a general practitioner?
No, I think it's intimidating, but honestly, it is not a referral practice like procedure. I think it's actually a great opening for general practice that gives the general practice a mean to actually interrogate the gut without referring the case. Anyone can peel a dog with the capsule. And so the capsule is like a new tool for the general practitioner to diagnose GI disease with like endoscopy without referring the case. And then if they send the capsule, then they get like a full specialist consultation without referring the case. They don't have to spend any money with new equipment. They just have to buy the capsule, which is billed to the client.
Yeah.
They don't have to be trained specifically for that. A specialist will look at the pictures and the video, and they can share the results and the video with their client.
Or even, I suppose, then to the, if it's beyond them or something, and they refer the patient after, like they've got valuable data there as well of the small intestinal tract. So, and it's an adjunct, isn't it?
Yes, it's an adjunct because it can convince the people and the vet that it would be a good case to be referred, for example, for further investigation if the capsule confirmed their suspicion, for example.
So it's obviously very, very useful for GI bleeding and those sort of things. Are there other things we can use it for? I'm just trying to think like chronic diarrheas or stuff like that. What are other potential uses for it?
Yeah, so it's a good question. So at the beginning, I was using it only for GI bleeding. That's the main indication in people. But in people, they use it also for Crohn's disease. And I started reading about that. And then I use it like on my patients, for example, for whom like the GA was not an option because it was highly contraindicated. Mm-hmm. And I discovered that you can see a lot of lesions with capsules. So you can see vascular malformation, you can see lymphangiectasia, you really see like the lymph leaking.
Wow.
Yeah, it's really, really cool. So you can see that, you can see mass, you can see delayed esophageal like emptying. You can see a lot of disease. We see like inflammation, very erythematous, like an irregular like mucosa. I have a lot of examples. Recently, like last week, we evaluated a dog and we were looking for GI bleeding and we ended up like finding like other lesion in the intestine. And the intestine looked very, very irregular. And we scoped the dog and we did biopsy and he had like a lymphoma in the duodenum. So you can actually see a lot more than just GI bleeding.
Wow.
Okay, cool.
Wow. So chronic gastros, protein losing enteropathies, GI bleeds.
Yeah, I was surprised actually because lymphangiectasia, for example, protein losing enteropathy. I always I've been scoping like conventionally like dogs for several years, and in the duodenum sometimes it's not very obvious that you have protein losing enteropathy with the scope. And then I started doing ALICAM, and now I think there are more abnormality of dilated lacteals in the distal small intestine based on the ALICAM.
This must be like I've opened up all these areas of research for you.
Oh yeah, I've been doing a lot of research with ALICAM for sure.
It does. I'm fascinated by it. I'd love to start playing with it. Have you had any other cool cases, like cases where you expected one thing and then went, oh wow, there's a surprise?
Yeah, so I had actually to go back to IMHA. I had my coolest case. I will remember that all my life. I cannot share his name with you, but it's one of my favorite patients. He came to us and he was really sick. He was getting a transfusion, and I'm not lying. He was getting a transfusion every day, and that's why he was referred to us. And he was treated for IMHA. And then when we reviewed the case, we looked at all the parameters I talked to you about at the beginning, and then we figured out that maybe it was not a true IMHA from the beginning. And we scoped the dog with conventional endoscopy, because at that time I was not convinced about ALICAM. It was the really infancy of the capsule endoscopy in dogs. And then we couldn't see anything abnormal on the conventional endoscopy, but we didn't scope the entire gut, because with conventional endoscopy you cannot do it. And I went to a conference just before this case, and I saw like a presentation about capsule endoscopy in dogs, and so I was like, okay, let's try it. I was a bit desperate for that case, so I tried it. So I sent it away to the Infinity office. I got the report like within 24 hours, and they told me your dog has vascular abnormality. You need to cauterize it. And we never saw that on the conventional endoscopy. The dog was full of vascular malformation. The dog had cauterization with a special technique, and then he was transfusion free for 2 years.
Wow.
So he was about to be euthanized, and he survived 2 years, and it recurred after, but for 2 years it was completely perfect.
So he was never an IMHA. So he was on immunosuppressives,
Yeah.
and in the meantime he's bleeding from his guts. So did he have blood in his poo? Like, could you see the blood in his feces, or was he in a cult bleeder?
So when we saw the patient the first time, and he was so sick, he was not bleeding. He was probably bleeding, but I mean, he didn't have any melena. And when we looked at his blood work, we called the client back and we digged a little bit more into his history. And then the client told us, oh yeah, by the way, a week ago he had black stools.
Oh, there you go.
But it was intermittent.
Wow.
And this is the case I talked about earlier, where when we were cutting the poop, we would see like some discoloration inside.
Wow.
That's got to be one of the key takeaways from this. You got to cut the poop. Alice's tip number 1: cut the poop.
Cut the poop.
No, that was super informative, because I would have you just look from the outside, right?
I'm jealous because me and Gerardo are both in emergency. I feel like we're not going to get to use it very much.
Well, you can use it on YouTube. I'll buy one and just kind of see what you look like on the inside.
with VR. You want to go VR down my gut.
Yeah.
Alice, that's so awesome. Thank you so much for your time on this and for a very interesting, and I love new toys. I think the veterinary world, we're all a bit like that. Any new toy or any new tool that you can use to give you more information is always such a welcome thing. I think it's going to be lovely for people to hear. Thanks so much.
No, you're welcome. I think it's a great tool, and I will just add something. Is at the beginning I was just using it for diagnosing, and now I'm using it for monitoring. So I'm monitoring a lot of patients with ALICAM when I want to see their response to my treatment. Before that, I didn't have any tool to do it, because I would have had to put them under general anesthesia to rescope them.
Yeah, of course.
With the capsule, I can now monitor them. So I think it's a big advantage. And for general practitioner, it's huge, I think.
Wow.
I suppose because you're specifically with GI bleeding, we just discussed how it's sometimes the symptoms are not that obvious, because you're not, when it starts, let's say you're treating a big ulcer or something. How long do you treat for? Well, I don't see any blood in the poo anymore. Everything looks normal, but you don't know that it's actually healed. So then would you shove shove a camera down and go and have a look at it and say, yes, it's healed, or actually, no, it's still eroded. We've got to keep treating. Is that how you're using it?
Yeah, that's what I would do. And it's less expensive than a conventional endoscopy. You don't have any general anesthesia, and you're getting like a consultation at the same time. So the client are not reluctant at all.
That's brilliant.
And it's minimally invasive, and all the clients are in favor of minimally invasive procedures. So
of course, yeah.
But there is no special Googles. I'm sorry.
I was about to just say we'll wrap up here, and I'll have a chat to Hubert with his, his sidebarring conversations about VR headsets, because it's not appropriate, is it, Hubert?
Remember to go and check out the show notes at thevetvault.com for a summary of what we've discussed today, as well as to go to forlim.com.au and use the discount code VV to get 10% off your first order of ALICAM. And if you found value in today's content and you can think of a friend who might find it useful, click that share button and send the link to them. Thank you for listening.